Hi.
Abby, nice to meet you in person-ish.
Yeah, you too. How are you doing?
I'm good. I'm wondering if I should turn this light off behind me.
Oh, the fun of Zoom.
Yeah, I feel like it's too dark maybe without the lights. Yeah. You'd think that I would be better at like this virtual stuff right now, but okay, yeah, so I don't know, can I try sharing my screen and then we'll like kind of get that set up?
Sounds good.
Are you, hold on, I think I did it wrong, just a second.
So right now I see your slides with like your speak. There it is. Yep, there it is. Perfect.
Okay.
We'll give it another couple minutes. People come in a little late, so.
Hi, Lindsay. Nice to see you.
Hi, Anusha. Hi, everyone. It's so nice to see you. How are you?
Doing okay. Just trying to keep all the balls in the air. How about you?
Similar. I can definitely understand.
Yeah, it's like not a one-word answer anymore, is it?
Yeah, it's a long story. Better saved for another time.
Well, I would love to chat with you sometime.
I would like that a lot. Thank you so much for being here. I love the painting behind your head as well.
Oh, this one?
Is that a painting? I can't tell.
It is a painting. Yeah. Thank you. Yeah, I like bright colors, and Leela is very into rainbows. So she says like, she can't say rainbow, she says babo. So she looks at it and says babo, which I think
That's so sweet.
yeah.
How old is she now? How's she doing?
She turned 2 on Monday.
That is crazy.
I know. She was born like 5 days after we went on to lockdown.
Yeah.
And yeah, in California, we went lockdown early, but yeah.
Real pandemic baby.
But it was before like we knew anything. Like my husband was there, like no one was wearing masks. So
It's wild.
yeah. Yeah, but she's good. She's at daycare and she loves it. So
Good. I'm so glad. Good. Well, we'll have to catch up.
yeah, sounds great.
Abby, do you want to give it another minute or should we jump in? What do you think?
Let's wait one more minute and then I'll start off with an announcement and then I'll turn it over to you, Lindsay.
Sounds good.
You'll do introductions today? Is that all right?
Yeah, I can do the introduction.
Thank you. Perfect.
I like the painting behind you too, Lindsay.
Oh, thanks. Yeah, this has been my unintentional Zoom setup for the last like 2 years.
Intentional or unintentional?
Unintentional. I'm sitting in my dining room.
I agree. I need to be a little bit more, I don't know, like some people have like nice lights that make them like look really pretty, right? Like anyway,
like the ring light. Yeah, I never did that, but
either.
probably it.
I know. I feel like I might be giving more virtual talks, so I should maybe think about this at some point.
Yeah, I don't think virtual talks and meetings are going to go away. So.
Right. Yeah.
Okay, I feel like Abby, should we start?
Sure.
Okay, great. So thank you so much, everybody, for being here.
Wait. Before you go, Abby's got to make.
Oh, you have an announcement. Sorry, ignore me.
No, you're fine. I have 2 events that I would like to talk about really fast. I'm putting the flyer in the chat. So the first event is a celebration of our graduates in CSEF and in our social epidemiology certificate program. So we would love for you all to join us on Wednesday, April 13th in the CSEF suite. I've talked about this event a couple times, but I would just like to highlight that we are bringing a photographer from Marcom to the event to take some like more professional photos, and also we'll have like little selfie props to take. So for our graduates, if you'd like to bring your cap and gown, it's a good opportunity to get like a nice picture of yourself. Please RSVP for that event by April 6th. And then our other event is at the end of April, our spring social gathering. If you've been to this spring event ever, it's really informal, very chill. We'll have a potluck. We will ask you all to bring side dishes. We'll have a bouncy house and other outdoor games, and you are welcome to bring friends, family, partner, roommates, kid kids, whoever. And we would like you to RSVP for that event by April 18th. But we're really excited to see you all in person, hopefully for those events, and we hope you'll join us. If you have any questions, just let me know. And I think that's it. So Lindsay, go ahead.
Okay, thanks, Abby. Sorry. And I'll be brief. So thanks everyone for coming. And a special thank you to Dr. Anusha Vable for joining us today. And Dr. Vable is an assistant professor in the Department of Family and Community Medicine at the University of California, San Francisco. She's a social epidemiologist, which is fitting. And her research agenda focuses on identifying scalable population level solutions to racial and socioeconomic health disparities. And in particular, she focuses on education and educational interventions and how they impact dementia, cognition, and other diseases of aging. And I'll leave everyone to read the rest of her bio in the email that was circulated today. But specifically, Dr. Vable is going to be talking about her work using sequence analysis to operationalize life course exposures in social epidemiology, which I'm really excited to hear about. So with that, I will turn things over to Dr. Vable. And really briefly, would you like to take questions as you go or save them until the end?
If it's okay, like unless it's a clarifying question, if we can save it to the end, that would be great.
Okay.
Just feel free to put them in the chat and we can, yeah.
Yeah, and I can help monitor it too.
Thank you. Oh, okay, right. So I start. Okay. Hello. Thank you for inviting me to present here today. So rather than, Lindsay kind of told you about my overarching research agenda, but rather than talking about my body of work today, I'm interested in talking a little bit more about some of my prior and proposed work using sequence analysis, as well as teach you a little bit of the intuition behind sequence analysis. I know it's a bit of an atypical format, but I hope that you'll bear with me because I have 3 reasons that I want to focus on sequence analysis today. One is that I think it's a really powerful and underutilized methodology. 2, I think that the intuition behind it is not that difficult. Actually implementing it is more challenging, but the intuition is not so challenging. And then 3, you have in-house expertise at University of Michigan in sequence analysis, because when I was teaching myself sequence analysis from a STATA manual, I emailed Lindsay a lot. And so I think I even have your code. And so, yeah, I just feel like you at University of Michigan are really well positioned to take this method and run with it. So yeah, I hope to maybe inspire at least one person to think about it today. Okay, but so first I wanted to just humanize myself a little bit. So I don't know if you guys know, I'm from Michigan, I'm a Yooper. I'm from the Upper Peninsula. I grew up in Houghton, which is here, if you can see my mouse. And this is one of my favorite hikes from the UP. I do a lot of hiking. It's one of the ways that I maintain my mental health. I'm also a Michigan alum. I got my MPH at Michigan. I actually used to work at CSEF for Allison Aiello, and I have been to that social that you were talking about, that Abby was talking about earlier. And I think that was like Sandro Galeo was there. I think it was back when he used to wear jeans, like he didn't wear suits all the time. So I've been, anyway, I was at Michigan in 2005, 2007. I also have a family. This is a photo of us out in Redwood City where we live last June. So my daughter turned 2 she turned 2 on Monday. And so she is really fun. And then the other thing I want to talk to you about a little bit is, or something that might not be clear from my CV, is just how often I've failed or been rejected. But first I want to point out, before I talk to you about all the times I fail, I want to say, like, I am relatively successful. I'm faculty at a soft money institution, which means I need to have multiple grants simultaneously, which I do. I have 2 R01s as PI, and we just got a fundable score on a 3rd R01 that is a multi-PI grant. Okay, so now I'm going to talk to you a little bit about failures. These are just a few examples. My first author paper was rejected 7 times. I didn't get into any doctoral programs the first time I applied. I failed the qualifying exam and had to retake a section. My loan repayment application was rejected 3 times before it was funded on the 4th submission. And I applied twice and never got a K award. And so I just want to mention that this career path gives you a lot of opportunities to be rejected. And I think that even people who are successful, we have all struggled a lot, even if you don't see it. So ask us sometimes. Okay, so this is an overview of my talk for today. First, I want to define sequence analysis. Then I'm going to do an applied example from my own work. Then I will talk you through the 3 steps of sequence analysis. Then I like to do a structural racism interlude in all of my talks now. I feel like this audience, maybe it's less required, but I'm going to do it anyway. And then I'm going to show you an applied example from Catherine Duart's work, who is she's a doctoral student I worked with. I was on her dissertation committee. And then also future projects and untapped potential with sequence analysis. Okay, so what is sequence analysis? It is not an exposure outcome analysis. It's an approach, or the way I use it, as an approach to operationalize variables comprised of ordered events. And so we're going to have examples of sequence analysis as an exposure and as a mediator today. So sequence analysis was developed to help understand DNA sequences in the 1970s, and it made the jump to the social sciences in the 90s. It can be used to analyze ordered sequences of base pairs or life events. We use it as life events in social epi typically. And so this is the paper that I think helped make the jump from the genetics to the social sciences. And I'm just going to read to this highlighted section. So it says, this article introduces a method that measures resemblance between sequences using a simple metric based on insertions, deletions, and substitutions required to transform one sequence into another. That's the whole method. That's the whole method in one sentence. So we'll talk a little bit about how exactly that works. Okay, so then what is the problem that sequence analysis solves? So the problem is that even with a few different states, so we might think of, if we think about employment states, we might think about yes, no employed. So that's 2 states. If we think about 2 states measured over time, so if we think about 18 to 65 years, that's 47 years of data, the number of potential sequences is 2 to the 47th, which I think I decided this is 140 trillion different potential sequences. And while the actual number of observed sequences in your data might be much smaller, it might be in the thousands, that's still like way too many things for us to dummy out, right? Like we need to reduce dimensionality and collapse a little bit. And so that was just for 2 occupational states. Like what if we're interested in more complexity? What if we want to differentiate if you're unemployed due to disability versus unemployed due to schooling versus unemployed due to maternity, like you're a caregiver, right? So I think that we need to, sequence analysis is a way for us to reduce the dimensionality so that we can actually analyze these sequences, like people's life course trajectories. Right, so the problems, so if we're interested in introducing more complexity, the solution that I know of right now, there might be more, is sequence analysis. And so what sequence analysis allows us to do is convert, here we have, I'll describe this in a minute, but here we have 3,000 unique educational trajectories, and we were able to transform them into 8 similar trajectory clusters using sequence analysis. So let me just walk you through this plot. It's called the index plot. And so on the x-axis, we have age. And so in these data, which are from the National Longitudinal Survey of Youth 1979 cohort, we had people's educational sequences, or we had information on their educational trajectories from age 14 to 48. So every year is like a little box on every age is time is on the x-axis, and then on the y-axis we have every individual in the data set. So like every row is a different person. And so I've also tried to make the colors a little bit informative. So like the orange colors are high school sequences, so enrolled in high school through GED. The blues are college sequences, so anywhere from enrolled in college part or full-time to BA, and then any sort of grad school is hot pink. And so what I just want to show you here is like the amount of heterogeneity we see in people's educational trajectories from age 14 to 48. Like there's a lot of heterogeneity here. We saw 3,000 unique trajectories, and we're able to convert them into 8.
Can I ask a clarifying question,
Yes.
Anusha? So like when a color sort of doesn't stops changing, like say this big block between maybe about 1500 and like 2500, that means the person stops at that level, right? Like it's not like someone is continuously enrolled in a GED all the way through age 45. They actually stop.
Right. Yeah. So the light gray is enrolled in high school, and then orange, and then this like kind of darker shade of orange is a high school degree only, high school degree and no more schooling.
Got it. Thanks.
Thank you for helping with that. Okay. And so then, but right before we go into some applied work, I just want to talk quickly about an important idea that underlies all of my work. And that is different markers of SES may be more or less relevant at different points in the life course. So we typically operationalize SES as education, work, or money. Some people view these measures are often viewed as interchangeable, but I differentiate them because I think your education predicts your job or your work predicts your income, and your income predicts your ability to accumulate wealth. And so each of these measures may be more or less relevant at different points in your life course when thinking about aging health outcomes. So for example, early in the life course, it might be more important to intervene on education, while later in the life course, maybe it's more important to intervene on income and wealth. Yeah, so, and so in this graphic, I'm just focusing on SES measures, and I'm not showing the more proximate mechanisms through which SES impacts aging outcomes, but they include, for example, medical care, behavioral norms, social environments, you guys know. Okay, so this is an applied example from my own work. This paper came out in 2020 in AJE, and we'll go over this in a little bit more detail. So our question was, does the type of educational credential, the trajectory to the final credential, or the timing of educational attainment differentially impact health? And so, for example, for type of educational credential, our question is like, does a GED and a high school diploma, do they confer the same health benefits? And so this first question, we can actually answer without sequence analysis, right? We can just do this in a typical regression framework. And then this next question is, does the trajectory to the final credential matter? So like if you got a BA after getting this is, for example, if you got a BA after getting a GED, does that confirm the same health benefits as getting a BA after you have a high school diploma? So this trajectory question, we can't do that with our typical regression approaches. We need to think about different ways to operationalize the outcome. Sorry, the exposure. We need to think about different ways to operationalize the exposure. Another question we had is, does timing of educational attainment matter? So for example, if you get a BA at age 40, does that confer the same health benefits as getting a BA at age 20? And so I kind of want to go back to the title of my talk, which is We Can Do Better. And I don't know how audience participation will go here, but I wanted to ask you, like, using conventional approaches, if our questions were about trajectory to the final credential or timing of the final credential, what kind of approaches would you think about using? I actually don't know. I don't know what you would do for this. I think like what I have seen is people make like categories. They'll say like, okay, did you get your BA before age 25 or did you get it after age 25, right? And so like we're saying like 25 is an important dichotomization point, right? But like, what if they got their BA at 26, right? Should they really be grouped with everyone who's later, right? And so I think that sequence analysis is a really powerful method for us to actually model what we're observing in our data. Okay, so our methods for this paper was we used the National Longitudinal Survey of Youth 1979 cohort. So people were aged 14 to 22 at baseline, and it's a prospective cohort, so people continue to be followed over time. We used outcome data at age 50. Our exposure was educational trajectories, and we're gonna go into this in more detail, but briefly, there are 3 steps to operationalize educational trajectories. First is you have to create the individual level trajectories. Second, you calculate the distance between the trajectories. And then third, you have to group the similar trajectories. And so that is what we do with sequence analysis. Our outcome was the physical health component summary score from the short form 12-item short form survey. And it was assessed at age 50. And the range is from 0 to 100, but it's centered at 50. And then our analysis approach was, so we created our educational trajectories, and then we put them in a linear regression model as demi variables, and we adjusted for birth cohort, race, sex, southern birth, rural residence, and a lot of different markers of childhood SES. And so just very quickly, using sequence analysis and cluster analysis, we were able to convert these over 3,000 unique educational trajectories that we observed into 10 trajectory clusters that are important predictors of physical health component summary score. And so the clusters that we ended up, that the data ended up telling us were the relevant ones were less than high school, GED, some college after a GED, an associate's degree, associates after less than high school, a BA immediately after you graduate after you graduate high school. The BA trajectory was interrupted, there were gaps before completion, or the grad school trajectories. And so I suspect a lot of you have questions about how we got from 3,000 to 10, and you should. This is the magic of sequence analysis, and we're going to go over it in more details after we go through this motivating example. So I told you about our research question, and I told you about the trajectory. So let me just orient you to this slide. So here we have our results, and on the x-axis we have differences in physical health at age 50. On the x-axis, we have differences in physical health at age 50 for each educational trajectory compared to those with high school only. The point estimates go from the least education to the most education. And so as you see, we kind of see the expected gradient where people with with more education have better health. And so, yeah, generally we find the expected gradient. But there's a couple interesting findings I want to point out. First is that we found that the type of credential matters. So we found that the reference group is high school, and that's depicted by this black line. And so we found that people with a GED had poorer health than people with a high school diploma. So lower numbers are worse health. And so we found that the type of credential matters. Second, we found that the trajectory matters, not just the final credential. So we found that people who got some college versus some college after getting a GED, the people who got the GED, they had meaningfully poorer physical health at age 50 than people who went for some college, but after a high school diploma. We also found, for the AA trajectories, we found that people who got an associate's had not different health than people who had a high school degree, but people who got an AA after less than high school, they had poorer health. And this confidence interval extends beyond the range of the graph. So it was a small group of people who had an AA after less than high school. The third thing we found was that timing of attainment matters. So we found that people who got a BA immediately after high school had better health than high school only, versus people whose BA trajectory was interrupted, they had poorer health than people who got their BA immediately. And so we found that physical health was differentially predicted by type of educational credential, trajectory to the final credential, and timing of educational attainment. And as I kind of mentioned, these trajectory and timing questions, we were only able to answer with sequence analysis. We wouldn't have been able to we wouldn't have been able to see this with our data without sequence analysis. Okay. So I hope that I've motivated you to now study sequence analysis, or you maybe are more interested in sequence analysis than you were before. So now I want to go through implementing sequence analysis. So there are 3 steps to implement sequence analysis. First is the data cleaning for the individual level trajectories. Then there's the sequence analysis to calculate the cost between each trajectory. And finally, cluster analysis to group similar trajectories. Okay, so first is the data cleaning for the individual level trajectories. I have found the data cleaning to be challenging and time consuming for sequence analysis in a way that it's not for most other analyses. You have to spend quite a bit of time with the data cleaning for this. What we did in our analyses in NLSY is we created data cleaning rules to both simplify, to reduce the number of decision points we had to make. Like we were just like, okay, we have a rule for this and let's see what the rule says. And also we published that in the appendix for transparency. So I'll go through this in a little bit more detail. We also found that the most vulnerable people tend to have the messiest data. And so after you do the data cleaning, the result of the data cleaning is that you can create an index plot after you clean the data. And so what I mean when I say is the most vulnerable people tend to have the messiest data is, this is an example for someone who's like not actually that challenging, but like, so in NLSY every year they say, what was your highest grade completed? And so for some people, it would be like 10, 10, 10, 10, 12, 12, 10, 10, 10, 10, 10. And so the question is, what do you do with that person when they give you data that you, like when the data that you observe are not, they're not sensical, like education, we know that it has to increase over time, or like it's either flat or increase, it can't go down, right? And so we have some options. We can either exclude that person, being like their data is really messy, but you know, we're social epidemiologists and we care about the most vulnerable people. Like we want those people retained in our data set. We don't want to drop them just because they have messy data, because that messy data indicates something, right? So we can exclude them. Another option is that we can make assumptions and data cleaning rules to clean that person. So for example, we can decide that they were 10 the whole time and there was social desirability bias. And sometimes they said they had 12 years of education, but they really had 10 and we're just gonna go 10 the whole way. Or we could decide that maybe they got a GED when they said they had 12, but because of the way the wording, the question is worded, like the question is worded highest grade completed. So we could say, and I think this is what we did do, we said if they have 10 for multiple years and then they say they have 12, we assume that they got a GED, and like we put that in our data cleaning rule and we code it like that. So some people might disagree with those rules, and that's why I think it's important to publish them, so that if people want to do it a different way, they know both what we did and then they know where they can change it. Okay, so after you do the data cleaning, then you have to do the sequence analysis to calculate the costs between the trajectories. And so this is an example of, and so sequences can both differ based on length and the state at each time point. So these are our data and they're wide here. So every row is a person and every column is a time point. And so state 17 is the educational state at age 17, states 18 is educational state at age 18, etc. Okay, and so they can differ on length, although I'm only showing the same length and the state at each time point. So let's look at this like a little bit more closely. My notes are over here, so that's why I'm not looking at you. I just want to make sure I say all the things that I need to say. Okay, so we see that this first person dropped out of high school before age 17, and then at age 20, they got a GED. Whereas the second person dropped out of high school before age 17, and they didn't get any more schooling before age 22. So you can contrast these first two people to these third and fifth people who were enrolled in high school. This third person was enrolled in high school at age 18, they enrolled in college full-time and they had a BA at age 22, versus this fifth person enrolled in high school and then enrolled in college at age 19, and they didn't have a BA by age 22. So we can tell the people in blue are similar and we can tell the people in pink are similar, but how similar? Like, can we collapse these people? I don't know. We need like a principled approach to tell us when we can combine people into the same cluster and when we can't. So and so sequence analysis does this by assigning costs or penalties for every change. We need to make two sequences the same, and then we sum those costs across the trajectory. So for example, here, if we're comparing person 1 and 2, these are the same. Their costs would be 0 at age 17, 0 at age 18. Costs to change one to the other are 0 at age 19. And at age 20, they're non-zero, right? 21, non-zero, 22, non-zero. Same here. For these pink people, when the states are the same, the cost to change it is 0. But here, the states are different, so it's non-zero. Here, it's going to be 0 again, right? But then at age 22, it's different, so it's going to be non-zero, right? And so we sum, so we do it for every trajectory, and then we sum across the trajectories. Okay. So right now I'm just saying 0 and non-zero, but there are infinity numbers that are non-zero, right? And so this is where things get like a little bit more subjective and tricky. So if the costs are non-zero, what are they? I'm not going to tell you how you should assign costs. I think that should be motivated by your research question, but I will show you some options and some things to consider. So there are two types of costs with sequence analysis. There are insertion deletion costs or there are substitution costs. So insertion deletion costs are when you remove a state or insert a state. So for IDs 1 versus 2, you can see that at the first 2 years, they were the same, and the last 4 years, years 4 and 5, they were the same. And it's really at year 3 that they're different. And so we could think about like deleting this 1 and all the 2s will bump up, right? And so then these 2 sequences will be the same. Or we could think about inserting a 1 here and bumping these 2s down. You guys can see my mouse, right? Yeah, okay. And bump these 2 down. And so these 2 sequences would be different. And so doing insertion deletion costs changes the length versus substitution. So we're going to do substitution for IDs 3 and 4. You can see the first 2 years are the same. The second 2 years, they're the same. So we can't do an insertion deletion to make these 2 sequences the same, right? We need to do a substitution. And so we can substitute 3. We can either substitute this as a 1 or this as a 3 to make these 2 sequences the same. And so in terms of the relative costs of the substitutions and the insertion deletions, like we might think about a substitution as 1 insertion and 1 deletion. So we might think about the substitution cost as 2 times the insertion deletion costs. Okay, but then there's like a lot more options for the substitutions cost. So do we want to say going from 1 to 3 is the same as going from 1 to 5? I don't know. So what we did was we did the mean probability distance. And so what that means is that costs that are, or transitions that are more frequent were assigned lower costs than transitions that were less frequent. And so this is the cost matrix this is portion of the cost matrix. And so for just the first 4 states. And so the first state is enrolled in less than high school, and GED. And this is a symmetric matrix. So to go from, if there's no cost to go from enrolled in high school to enrolled in high school, so it's 0. And so it's always 0 across the diagonal. And so like if we want to change enrolled in high school to each of these, so let's say we're interested in change one sequence to another, we need to change enrolled in high school to the other states. So enrolled in high school, of these 3 in this column, enrolled in high school to high school has the lowest cost. So that transition is one of the most common ones in the data set. Versus, which one is the next? So this has the lowest cost, so this is very common, versus going from enrolled in high school to less than high school, this has higher costs, and then enrolled in high school to GED has the highest cost. So does this make sense? Like we assign costs based on how frequent the transitions are in this example. Okay, and so the other thing that's like kind of weird here is that because we said that the substitution costs are going to be twice the insertion deletion costs. In our cost matrix, our substitution cost matrix, all of these are like kind of close to 2 because we've said that it has to be twice, right? Because that made sense. But also the mean probability distance made sense. And so when you kind of layer these things on top of each other, qualitatively, I see how they're different. Quantitatively, in terms of how it affects our final point estimate, like our final conclusions, I think we have methods work to do here. Here's another option for calculating costs. We applied the Halpin optical matching algorithm. So that applies a downward cost adjustment based on duration, for example, because the educational state at age 18 and 19 are not independent, right? So this method was developed in genetics where we might think that 2 base pairs are independent, but when we're applying it to life course research, our 2 states are not independent, right? And so we might, like the Halpin approach applies a downward cost adjustment based on duration. You might be interested in applying an upward cost duration, like it depends on your research question, right? Another thing we did was, so this is our primary approach in our paper, but we did a sensitivity analysis where we did dynamic hamming. And so with dynamic hamming, there are no insertion deletion costs. And the substitution costs also change over time, but they are less costly when transitions are common. So as applied to our data, maybe like 18 to 25, where people are kind of changing, like that's a time of great transition for your education. So maybe costs are lower than versus 40, where people are typically not changing their education as frequently. Yeah, so as I said, I think that methodological work is needed. Maria Gleamore is one of my colleagues, and she was kind of making fun of me because she's like, Anusha is the only person I know who will publish with a method several times and then be like, we need a lot more methods work. But we need a lot more methods work here. Like, I think that qualitatively we can see how these different cost options are different, but quantitatively we don't know how it's changing our conclusions. And so I think we need to do methodological work here. And we have some ideas. We have some analyses planned to kind of help with this going forward. And so after you finish the sequence analysis, you get the product of the sequence analysis is a cost matrix. And so this is a portion of the cost matrix. And it shows the cost to change every sequence to all other sequences in the data set. So it's a symmetric matrix again. So I'm just showing you columns 7,761 through 66, and then some rows. And so if we want to, I'm just going to refer to it as the last two digits. So if we wanted to convert person 61 to 61, there's no cost for that, right? It's 0. But if we want to convert 61 to 64, the costs are like 0.64. And if you look, that's kind of one of the lower costs. So probably 61 and 64 are more similar, right? Versus 61 versus 63, those costs are pretty high. Probably those people are more different. And so now that we have this gigantic matrix of costs to convert one person to the other, we need to implement cluster analysis to kind of break this matrix into our educational trajectory clusters that we're going to put in our regression model. And so what we did was we used agglomerative hierarchical cluster analysis. Again, there's a lot of options with cluster analysis. So this is like another subjective place in the analysis. But we did agglomerative hierarchical cluster analysis. I did not make up these words, but I feel like this is an example sometimes where academics use like extremely complex words to explain something that's like not that complicated, which makes it less accessible. So agglomerative hierarchical cluster analysis just means that at the beginning, every trajectory is a distinct cluster. So we had like 3,000 clusters, and they're all just, we had 3,000 unique trajectories, and they're all distinct clusters at the beginning of cluster analysis. And then we slowly increase the, let me see how I said. Okay, so then it's agglomerative. So we sequentially combine clusters with the most similar class until eventually at the end of the cluster analysis, we have one cluster. And so we can prioritize different things when we combine the clusters. We use the Ward's linkage, which maximizes similarities within cluster. And then next we have to figure out how many clusters we want. And so you can use cluster stopping rules for that. And there are different clustering stopping rules. We did the Duda-Hart criteria, which maximizes distinct cluster structure. Okay, so, and then we ended up with 10 clusters. I'm gonna do, okay. We have another applied example, but right now I wanna go into the structural racism interlude. Okay, so I was taught that racism occurs on several levels. We'll discuss structural racism a bit more, but briefly, it's a system of mutually reinforcing structures and policies that results in systemic oppression of poor people and people of color generally, but is especially successful in systemically oppressing Black people. Then there's institutional racism, and that's racism that occurs within institutions. So like hospitals, universities, businesses, nonprofits, that's within an institution, that's institutional racism. third is interpersonal racism, and this occurs between individuals, and you can think of this as intentional or unintentional racism, and it includes microaggressions. And then the third level is internalized racism. And so internalized racism occurs when the social norms and expectations of society are reflected in an individual's view of themselves. So for example, if someone thinks they aren't deserving of food even when they're hungry, that might be an example of internalized discrimination. And I use that example because it comes from my colleague's work. Like, she has found that there are people who are food insecure and they feel they're not deserving of food. And so I just want to make sure that we know that internalized discrimination is pernicious, it's not benign. And so too often in research, we focus on interpersonal racism and we don't focus enough on the monstrous structural racism that really bolsters and scaffolds racism at every other level. And so, let me just see what else I wanted to say. Right, and so until we address structural racism, we won't be able to fully eliminate the other forms of racism. We have to address the structural in addition to all the other forms of racism. The other thing I wanted to mention is that while structural racism has been well explicated, this structural nature actually applies to many kinds of discrimination, not just racial discriminations. For example, gender discrimination is written into our tax code, and I certainly have internalized gender stuff going on because I grew up in this world where there are gender norms and I was socialized in this world. And so I think that this is normal. Right, and so okay, and too often in research, we focus on the interpersonal and not on the structural. I mentioned that, okay. So if you haven't already, I really strongly recommend this paper that came out in 2017 in The Lancet by Anusha Vable and colleagues, and they define structural racism, and it's great. And so this is just a quotation from the abstract of Zinzi's paper that I want to read to you. So she wrote, structural racism refers to the totality of ways through which societies foster racial discrimination through mutually reinforcing systems of housing, education, employment, earnings, benefits, credit, media, healthcare, and criminal justice. These patterns and practices in turn reinforce discriminatory beliefs, values, and the distribution of resources. And so this is the quotation I just read depicted graphically. So I'd like to follow a few of these arrows and we can see how when you ping one system, it really pings every other system. Okay, so first we know that redlining meant that Black folks were not able to get credit to buy houses in certain areas. In this country, we tie the funding of our education, our K through 12 education system, to our property taxes. And so we know that quality varies widely based on where you live. We also know that there is a school to prison pipeline. And when I talk about Catherine Duarte's work, or sorry, Duarte's work, when I talk about Catherine's work, her work is on this pathway. In this country, we've decided if you're engaged in the criminal justice system, you really are going to be punished for the rest of your life. And so with the criminal justice, like if you have a felony conviction, like you're not able to access the safety net, you're not able to vote, you're not able to get certain jobs. And so criminal justice involvement really has lifelong consequences. In this country, we've decided that we're going to tie our health insurance to our jobs. And so our health insurance access and quality is really socially patterned such that the people who already have the most have, like me, I work in a university, I have very good benefits versus people who are not able to work in a university. We know that there's high social patterning. We also know that employment affects your earnings and also your ability to get credit. And credit affects your ability to rent and own a home. And so we can see that just through following following the housing arrow, we can see how it affects every other system. And so this is structural racism. It's the mutually reinforcing systems that together result in systemic oppression. there's a couple things I want to point out. One is that these arrows didn't happen in a vacuum. There's a reason that these exist. And two is that these arrows are choices and we can make different choices. So for example, we can decide that we can decide that we're not going to tie the funding of our schools to the property taxes. Like we can break this arrow. We can decide we're not going to have our healthcare access and quality be determined by your employment status. Like we can break this arrow, right? So that is the goal. We need to break all of these arrows. We need these to be null results in order to address structural racism. And it's not going to happen probably in one generation, but I think as long as we're all pushing in the same direction, we can make a difference. And so I'm going to end the interlude and discuss some of Catherine Duart's work, which I think is a really nice example of how we in research can like think about structural racism, but like make it accessible in an applied example. So Catherine's work is on exclusionary school discipline and dementia risk. And I'm actually just going to I'm going to just read a section of her introduction to you because I think she explains it really nicely. So what she wrote was that punitive exclusionary school discipline, which removes students from their classroom via suspensions and/or expulsions, is a mechanism of structural racism that disproportionately shapes the educational experiences of racially minoritized children in US schools and may have implications for their health and health inequity. She goes on to say that as early as preschool, Black students in particular are monitored more closely for perceived misbehavior, targeted more often for discipline, and punished more severely than white students. And these inequalities persist across grade level, independent of student behavior. So I should mention first that Catherine is going to be presenting at SER in June. And so if you would like, she's going to be presenting on both of, I'm actually showing you results from 2 papers. She's going to be presenting on both of those papers. And so I really encourage you to go to her presentation and visit her poster because she's just a great scholar. I think that you guys would like meeting her. And she can also obviously talk about her work better than I can. But so this is some of her dissertation work. And so, in her first paper, she looked at the relationship between exclusionary school discipline and dementia risk. And then the second paper, she evaluated if the educational trajectories that we were discussing earlier, if educational trajectories mediated the relationship between exclusionary school discipline and dementia risk. And the way she defined exclusionary school discipline was suspensions and expulsions. Okay, so this is her first analysis, right? So first analysis, second analysis, right? And so what she found was that there was a relationship between exclusionary school discipline and dementia risks. I want to emphasize that these are preliminary results, and so the numbers might change. So please go to Catherine's SER talk. So dementia risk is bounded between 0 and 1. So even this point estimate looks tiny, it's actually like quite substantial. And we will do a better job contextualizing this later, or like for her SER talk, but this is a meaningful increase in dementia risk from exclusionary discipline. This is the association she found. And then her next question was, does the educational trajectory mediate this relationship between exclusionary school discipline and dementia risk? And she found that 60 to 70% of the total relationship was mediated by educational trajectories, which I think is huge. And so really, I feel like she is pointing out that we can intervene several places and potentially reduce dementia risk on a population level and also potentially reduce dementia risk disparities if these results are causal. Okay, so I just want to talk a little bit about my future projects using sequence analysis. So I have one R01 where I'm hiring for it right now, where we're looking to evaluate life course work trajectories and dementia risk using sequence analysis. And then we got a fundable score on another one to evaluate life course food insecurity trajectories across the life course and sequence analysis. This one's not funded yet. We're just hopeful that it might be funded. Okay, that's why it's dashed. I also want to talk about the untapped potential. We're wrapping up now, but I think that sequence analysis has a lot of untapped potential. You can really use it for any life course exposure, any life course or variable, any variable that accumulates over the life course. So for example, I'm working with a doctoral student right now who's looking at air pollution trajectories from 2000 to 2010 and how that predicted dementia risk, how that predicts subsequent dementia risk. I feel like you can also look at trajectories, so trajectories of housing insecurity. There are a lot. This is not work that I'm doing right now. These are just ideas that if you would like to take it and run with it, please do. Trajectories of housing insecurity, there's a lot of different ways to be unstably housed. And I feel like we don't have a great idea if there are similarities in these trajectories or if it's just kind of all random. Also, the transition to retirement is a great example or application of sequence analysis, and also like description of data. So this is a graphic I put in my last grant application. And so this is food insecurity status from 1979 to I think this is 2019. And so even though, I'm not a food insecurity expert, but my read of the literature is that most of the analyses are cross-sectional. And so what we see here in these data are that once people become food insecure, they are really food insecure for the rest of their lives. And so for most people, this is like a multi-decade exposure. And if we're only able to, so I think that sequence analysis is a really powerful way for us to be able to show people's actual lived experiences without like reducing the dimensionality of the data. Okay, I just want to close with this quote by Beverly Daniel Tatum, and then I'm happy to take any questions. I'm going to read it out loud for you. Okay, so she says, I sometimes visualize the ongoing cycle of racism as a moving walkway at the airport. Active racist behavior is equivalent to walking fast on the conveyor belt. Passive racist behavior is equivalent to standing still on the walkway. No overt effort is being made, but the conveyor belt moves the bystander along in the same direction as those who are actively walking. Unless they are actively walking the opposite direction at a speed faster than the conveyor belt, unless they are actively anti-racist, they will find themselves carried along with the others. I think about this quote a lot. I think it's a really powerful example. Okay, I'm happy to take any questions and thank you for your attention.
Thank you, Anusha. That was wonderful. While people take a moment to think of any questions, I just wanted to say how inspiring that talk was, how exciting it is to see you building up this program of research around sequence analysis and these really kind of important long-term exposures that people experience in relation to dementia risk. I'm so excited. I remember the early days of talking about this with you.
Yeah,
this is really awesome. And I also wanted to especially say thank you for calling out your failures in the beginning, because we all have those. I mean, I certainly do. And like, we never hear them, especially kind of at the trainee stage. And like, I'm just so appreciative. And we can talk about this as a group too, this kind of like thing around failure in academia.
Yeah, actually, when I was deciding last week how I wanted to give this talk, I was talking with Kate Deshani, who I think some of you may know. And she was the one who's like, humanize yourself and tell them about how you failed. I thought that was a really good suggestion.
There's a question in the chat from Victoria. Victoria, do you want to read it out loud, or do you want me to read it?
I can just ask straight out. I'm asking, thank you so much for such an amazing talk. It was very informative. I'm just curious whether you could recommend some basic resources for somebody who'd never done that. So I'm very interested. So yeah.
Yeah. So Lindsay, I don't know of any coursework on this. Like, someone was wanting to put it in their K, and I was like, they were asking me if there's any coursework, and I was like, I taught it to myself from a STATA manual. Like, I don't know that there is much, right?
There's literally none. I also taught it to myself from the STATA manual and some like really old sociology papers. But you wrote a really nice Twitter thread, didn't you, on resources for sequence analysis?
Yes.
Or am I misremembering?
Yes, I do have a Twitter thread on resources for sequence analysis. So, I mean, it's mostly just applied examples of the STATA manual, but I'm happy to circulate that. Yeah, I think that we're also like part of what like we're trying to do with like I think this is a really powerful method, and so I'm going to try to create more papers about like to kind of explain it and like make it a little bit more accessible, but it's a few years down the road.
Yeah, I think we actually need some applied training resources. I think your Twitter thread, I can also certainly share a few papers, like circulate a few papers. Checking reference lists, like the reference list of Anusha's paper is probably fabulous. And the paper I wrote has like whatever resources I read, like those old sociology papers I referred to. We kind of, Elizabeth Rose Maeda and I wrote a textbook chapter on life course epi, and we sort of have a section on sequence analysis, but it's not technical enough, but it has some introductory things. We can both circulate things.
Yeah, Lindsay, maybe you and I should think about writing an SER playlist together about sequence analysis resources.
I think that's a good idea.
Yeah, maybe a workshop on sequence analysis is also due.
Yeah, maybe we can think about doing that sometime, Lindsay, for SER.
Okay. Yeah, and Bree suggested developing a course on it for the summer session in EPID. If you're interested, Anusha.
For the summer? I really value not working in the summer.
Let's talk further.
Later. I'm broadly interested in producing and helping to produce more resources that will make this method more accessible.
Okay, Bree's trying to convince you in the chat. A week in Ann Arbor in the summer. Who wouldn't want that? There's a question from TC. TC, would you like to read it out loud? Or I can if you prefer.
Yeah, I think it's a follow-up question to the sequential analysis. So just wondering, like it mentioned that the three important things are credential, trajectory, and timing of education. Like which of the three would be the most important factor? If we can we see can we compare the importance of the three through the cost you show the numbers?
So I don't think that, yeah, like our research question was kind of like, do all of these matter, but not about the relative importance. I think that it's kind of like, I feel like we have a lot of measurement work to do for education too, right? There's actually a paper, it's called The Consistency Assumption and Social Epidemiology, When is a Rose Not a Rose, which I really recommend if you're interested in educational research. But like, I mean, yeah, I think it does a really nice job of pointing out like how far we have to go. Like, because right now we compare years of education, but we don't talk about quality, right? And quality we know varies widely from like based on geography, right? And so I don't think at this point, we can't differentiate which of those three is most important.
So the cost, just we could just tell the dissimilarity between like two paths of education, but a greater dissimilarity doesn't guarantee like which of the reason, like either timing or these would impact more.
Yeah, no, it doesn't tell us that. It just helps us differentiate the trajectories, but it doesn't tell us which of the trajectories is. Yeah, I think that's my understanding.
Sure. Yeah, sure, sounds good. Yeah, and I would be very interested in taking the potential course for this.
I am slightly warm. You know, I'm from Michigan, so I'm thinking about it. I am warming to the idea of coming to Michigan, but we'll see. I also have a baby who's here, so that makes things complicated.
Yeah, sure. Thank you.
Thank you.
Bree is dead set on making this happen in Anusha. And I feel like it's actually kind of, that's a good question, TC, about differentiating between the credential, the timing, the trajectory of what's most important. And I feel like that's actually really hard to do, and you can't do a sequence analysis.
That's what I was thinking too. I don't know if you can do it with sequence analysis.
No, and I don't know how they would be like, how you'd make the kind of the estimates comparable in a regression framework either. Are there any more questions for Anusha? Or does anyone else want to share their failures?
Yeah.
We should actually do this one day.
I feel like I might have more that I haven't shared.
Bree's first RO1 took 5 tries.
Yeah, there was an so I'm very involved in our Society for Epidemiologic Research. I refer to it often as SER, but SER, I encourage you to become a member. It's extremely reasonably priced for trainees. I think it's like $35 a year. And if you become a member, you have access to the SER archives. And in the SER archives, there's a lot of great talks, but there's one about, I think about it a lot. It's about writing your first RO1, and they talk a lot about how it's a combination of luck and persistence. And so it looks like, did she go by Bree? Bree had a lot of persistence for 5 times submission. So congratulations.
Yeah, I've heard, I think Linda Elizabeth says this, like you need to throw a lot of spaghetti at the wall. And I think that's definitely really true. Yeah, you don't take no for an answer. And like, for me, I never got a K either. And like, I tried to write a K and failed. Like that's as far as I got. I like wasn't persistent at all. And I also applied to like several faculty positions and just literally never heard back. Like there's some I'm still waiting to hear back from, and that's okay.
There's something about failure I wanted to mention too, because I think about this a lot with my daughter who's 2. So she's running now, right? And so she's learning how to run. And so she stumbles and she falls all the time. And so what she does is she comes over and she like comes in for a hug and like a little cuddle. And then she like makes sure she's okay. And she like just keeps on running. And I think that like we all used to have that. We all used to fall, stumble, get a hug, and then just keep going. And we've gotten away from that a little bit. And I think just, yeah, like failure is inevitable. We're not always going to succeed. Like stumbling is inevitable. And so I think everyone is like an opportunity to make sure that like this is really the path you want to go down. But yeah, I think it can be scary because sometimes the stakes are very high. So.
Yeah, the stakes are super high. And you know, like we even though we have failed in the past, we are examples of survival bias, right? So that's also like that's there. But like it's kind of like when you look at someone's CV, it's like an iceberg, right? That's what it made me think of, Anusha, when you first started talking about it. Like you look at someone's CV, you read someone's bio on their website, or you talk to them and you just see the successful things at the top, but you don't see every unsuccessful thing that's underneath it. And everybody has that.
We all have it.
Yeah, so it's 1 o'clock. It's probably time to go, although we could keep chatting for a long time. And Victoria also just shared some sequence analysis resources in the chat. And maybe Abby, like Anusha, you can either email maybe me or Abby with like your Twitter thread or any resources you want to share. And I can also share some, and maybe Abby, we can circulate it after the session today.
Yes, absolutely. Thanks, everybody.
Thank
Have a
you
good
so
day.
much for sharing your time and expertise with us, Anusha.
Happy to. Thank you for inviting me.